Module Overview. Scenario-based and ethical interview questions are cornerstones of recruitment for healthcare roles in the UK and EU. These questions are designed to assess not only your clinical judgment, but your moral compass, patient-centered thinking, compliance with professional codes of conduct, and legal awareness. Unlike competency questions which focus on past behaviors, STAR, scenario and ethical questions are often hypothetical, testing your understanding of complex issues such as patient consent, safeguarding, whistleblowing, confidentiality, professional boundaries, cultural sensitivity, resource prioritization, and more. By the end of this module, you will be able to identify common types of ethical and scenario-based interview questions, apply decision-making frameworks such as 4 pillars of medical ethics and GMCN, HCPC codes, craft structured, calm, and morally sound responses, justify their actions with UK/EU clinical and ethical standards. Navigate gray areas where no single correct answer exists, but judgment is evaluated. Section 1. Understanding ethical and scenario-based questions. Scenario-based questions present a dilemma or clinical setting and ask, what would you do? Ethical questions delve into values and right versus wrong decisions in a professional context. Common themes: breaking bad news, patient autonomy versus professional advice, confidentiality breaches consent with minors, safeguarding vulnerable adults, professionalism versus friendship, handling errors or malpractice, cultural or religious tensions. The 4 pillars of medical ethics, UK model. These guide your answers ethically and are frequently referenced in NHS/EU healthcare interviews. Pillar meaning interview. Tip autonomy, respect patient decisions, empower, inform, and never coerce. Beneficence act in the patient's best interest. Think, what's the safest and kindest route? Non-maleficence, do no harm, avoid harm even if unintended. Err on caution. Justice, fairness in resource use and access. Consider equality in healthcare law. Always mention at least 1 pillar when answering an ethical scenario. Even for non-clinical roles, this framework is valued across NHS, NMC, GMC, HCPC, and EU bodies. Section 3. Sample ethical scenarios and how to answer. Scenario 1. A patient refuses life-saving treatment. Answer guidance: respect autonomy, but ensure informed decision-making. Explore reasoning: fear, religion, misunderstanding. Involve senior colleagues or ethics team. Document refusal professionally. Scenario 2. You suspect a colleague is under the influence. Answer guidance: prioritize patient safety, non-maleficence. Report concern to supervisor privately. Avoid direct confrontation unless urgent. Follow whistleblowing protocols. Scenario 3. A child with injuries claims they fell. Answer guidance: child safeguarding laws come first. Record everything factually. Report to the safeguarding lead immediately. Do not confront parents or assume guilt. Scenario 4. You made a medication error, but patient is unharmed. Answer guidance: uphold professional honesty and transparency. Report the incident per protocol. Offer to explain to patient/family. Learn from it. Reflective practice. Section 4. Structuring your answer. ABCDE method. A simple structure to respond ethically in interviews. Step meaning: Tip A. Acknowledge the scenario. Summarize what's going on. B. Be calm and professional. Show empathy and restraint. C. Consider ethics/laws. Mention codes, pillars, or duty. D. Decide on action. Outline a practical, logical solution. E. Explain justification. Back it up with policy or value reference. Interviewers want to see maturity, compassion, legal awareness, and confidence in gray zones. Section 5. UK and EU legal and ethical frameworks to mention. For UK, NHS Constitution and core values, GMC Good Medical Practice, NMC Code of Conduct, HCPC Standards of Proficiency, Caldecott Principles, Data, Protection, Confidentiality, Mental Capacity Act 2005, Safeguarding Vulnerable Groups, Act 2006, Freedom to Speak Up, NHS Whistleblowing Policies. For EU, European Charter of Patients' Rights, GDPR for data and confidentiality, EU Fundamental Rights Charter, WHO Code of Practice for Health Workers. Section 6. Tips to pass ethical interviews. Stay calm. Ethical questions are not traps. They test maturity. Never guess. Say, I'd seek advice from my supervisor when in doubt. Mention frameworks. Use terms like autonomy, safeguarding, informed consent. Balance assertiveness and empathy. Show confidence in your decision, but care in its delivery. Document. In real life and interviews, accurate records matter. Section 7. Accreditation standards. This module meets. This module aligns with standards from Health Education, England, HEE, Interview Toolkit, GMC/NMC/HCPC, Professional Standards, EU Health, Workforce Governance Framework, NHS, Recruitment Values, Based Interviewing, World Health Organization, Ethical Guidelines, UK Clinical Governance Guidelines. It addresses domains such as clinical judgment, ethical reasoning, communication, safeguarding, transparency, and legal compliance. Summary. This module equips you with the tools to interpret and respond to ethically complex healthcare situations, use legal and professional standards to justify your decisions, align your responses with the NHS and EU's expectations of integrity and safety, deliver interview answers with calm, empathy, and logic, essential for clinical and non-clinical healthcare roles alike.